Good afternoon, Cedarfield family. Hope everyone is doing well here on Wednesday, 3 o'clock. Thank you for tuning in. Those of you that are here at the community, tuning in live, both residents and team members, we appreciate that. Those of you that are listening tonight, got an email last week that somebody listens to these videos actually every Wednesday night in China. So if you are here in the United States or around the world taking time to listen to these Cedarfield chats, we greatly appreciate it. We hope you continue to find these live streams or videos informative, which goes to a suggestion. Renee, Matt Dameron, and I, Renee Langley, we are open to any suggestions. If anybody has any relevant agenda items that we should consider in making this an even better Wednesday afternoon of information for folks, we are wide open for suggestions about things content to add to the live stream to make it even better. So if anybody has any suggestions, please feel free to email Renee Langley, and we will incorporate that into our live feed next week. The format for today is quite simple. You have yours truly here talking a little bit about COVID-19 communications. Matt Dameron is here to talk a little bit about our point prevalence survey that we conducted last Thursday. And then we had an infection control assessment on Monday for 6 hours with 2 registered nurses, independent of Cedarfield. Matt's going to go into a little bit more detail about that. And then we have another COVID-19 test for 285 people on Thursday of this week tomorrow. So Matt's going to talk a little bit about that and the reason behind that test. And then Trish, I think Trish is here. Trish Carter will be here to follow up with our spiritual well-being and some good news. And when she concludes the good news, don't leave your TV set, because Eddie and I have a little commercial break for everybody, and we want to show everybody a little video right after the good news segment. So those of you that tend to get off the couch and head out into another room, you're not going to want to miss this little 30-second video that Eddie and I would like to show folks after the good news segment by Trish Carter. So, Cedarfield Forward, our independent living three-phase plan. A little bit about COVID-19 and what is actually happening in the Commonwealth, and how does that relate to Henrico County, Chesterfield, Hanover, and Goochland and Richmond. So hopefully many of you have been following the news here about the pandemic. I call it the second wave of the pandemic coming through the United States. Virginia seemed to be sheltered there for a little while. If you go back maybe 2 or 3 weeks, we kept hearing about a surge in Florida, a surge in Arizona, in California, and then many of the southern states started to experience that surge, and it started creeping back up on the eastern seaboard, and it seemed like to skip right over Virginia here for the last 3 weeks. That has begun to change, as many of you probably tuned into the governor's briefing yesterday. The governor really did a nice job of utilizing the graphs, the bar graphs, to explain the situation here in the Commonwealth. Most districts are either at a little bit of an increase over the last 10 days Some districts are flattening off. The Hampton Roads area seems to be of major concern right now for the governor and the Department of Health. The Tidewater area, Virginia Beach, etc. So that is a hot spot now here in the Commonwealth. Northern Virginia, numbers seem to be going down. Here are the 7-day positivity rates that are near and dear, close to Cedarfield. Henrico is now at 6.1. It seems like it might be at 6.2, but that's an increase from last Wednesday where we reported a 6.0. Chesterfield last week was 7.8, so that's quite a bit of an increase for Chesterfield, now at 8.3. And then Richmond last week, I believe we reported a 5.7% positivity, and now it's at a 6. So 7 days ago, we were here talking about a different number, and all of these have increased. Hopefully you have watched the governor briefing yesterday or read about it in the paper, and he was talking about really speaking to a lot of the businesses, the business community in the Commonwealth. And when we naturally have that sign on the door where it says, no shoes, no, what else is there? No shoes, no shirt, no service. And he added in there yesterday pretty strongly, no shoes, no shirt, no mask, no service. So we didn't go backwards in a particular phase, but we have some pretty strong recommendations and enforcements that business owners are permitted to exercise. So, point prevalence survey, Matt's going to get into here in a couple of minutes. Just a little bit of a phase 2 review. Again, for those of you that hopefully everybody has their phase 2 plan that Renee printed out for everybody on your coffee table, and you're flipping through it as needed to understand what is and what is not permitted here at Cedarfield. For those of you that have it close to you, you'll notice that in that phase, when we printed phase 2, we did not have a florist identified yet. But as of last week, we do. And so if anyone that's listening to this video tonight, any resident wanting to send another resident some arrangements, we have done some research. Actually, Beth Burrell did some research with Coleman Brothers. They have some very strict protocols at their shop. They have one specific driver that's dedicated, and that is our florist of choice. Actually, it's been our florist of choice for many, many years. So if anyone would like to have a arrangement delivered, we are only accepting arrangements from the Coleman Brothers. The reason behind this is we have not opened up the campus as business as usual. We are limiting the number of people we're trying to limit the number of people who are at the community. That is our main focus at Cedarfield, is not to have an array of people who in every specific discipline that we once had back in January and February arriving at the campus. We're going to identify targeted companies that may come onto the property to limit exposure and the number of people who are actually here as best that we can. Again, if you have any medical appointments that you need scheduled, please call Ann Hopper and can get that on the schedule. We provide the gatehouse with a schedule of people who need to maybe come onto the property and pick up a resident. And so that list at the gatehouse is really important, where they're utilizing that list to permit people to come onto the property comparatively to turn people away. So if you have an appointment and you need somebody to pick you up, please contact Ann Hopper. And conversely, if you have a social appointment that someone is coming to pick you up, please contact Renee Langley. My public service announcement: Ann Hopper and Renee are at the center of picking up the phone and talking with people. If you could please, those of you that, there's a lot of energy, obviously, in trying to understand the do's and don'ts of Cedarfield. Ann and Renee are simply trying to follow Phase 2 plan. They did not come up with the plan, they were a part of it, but residents and team members came together to develop Phase 2. So if you're calling to schedule an appointment with Ann or Renee, I would please ask that we are polite and courteous in trying to get things scheduled. We've seen an uptick in the level of emotion when we're trying to schedule appointments, and it seems to be centered at Ann and Renee. And so I would just ask that we politely try to get things scheduled. If anybody has any energy around Phase 2, please feel free to contact yours truly, and we can have a very civil, intelligent discussion about why we have certain parameters in place at Cedarfield. The metrics behind our COVID-19 plan has to do, speaking of which, since we're talking about Renee, 1, 2, 3, happy birthday to you. She's saying stop. Okay. We have 500 people that live here and 300 people that work here. If you all want to come down and sing happy birthday individually to Renee, I'm sure that she would appreciate the stop by here in the next day or so. Metrics. Today is actually her birthday. Metrics for COVID-19. COVID-19 positivity rate, which Matt's going to get into a little bit about that rate from the point prevalence survey on Thursday. Thankfully, on the independent living side of the community right now, we don't have any residents, nor do we have any team members that are COVID positive, and we don't have any residents and any team members that are waiting tests in independent living. So that's good news. Likewise, our surveillance tools that we use to monitor signs and symptoms, we are currently not tracking anyone in independent living with any signs and symptoms. We have a few folks that are under quarantining protocols because they went to the hospital and had to stay there for an inpatient stay and or the emergency room. But we're not currently monitoring anyone with signs and symptoms. So that's further good news. And I like to think of it as everyone is doing their part. It takes a village, and everyone is doing their part to keep 400 people safe and clear of COVID-19, and approximately 200 people that work in independent living. So we're doing a great job. Contact tracing lists. We currently don't have any resident and or team member on a contact trace list. Matt is going to get involved in a little bit more discussion about the Virginia Department of Health guidelines. We do have confirmed collaborated information about two team members and some residents who left the community either by airplane, left the Commonwealth, and so we're tracking that. Those reasons for quarantine are becoming increasingly important for obvious reasons, because there is a surge greater than the 6.2% within the Commonwealth of Virginia outside of our state. And so we really do need to know if residents are leaving the Commonwealth. We do really need to know now if residents are going into the Hampton, or team members, if anyone is going into the Hampton Roads area, as that is a identified hotspot. So we're utilizing that data to move into different services and amenities with either caution or moving into a service and amenity because the data is telling us that we can. COVID-19 by the numbers, disclosure of information. So this takes into account last week's point prevalence survey. So as of last Thursday, we now have tested 163 residents, and 10 of which have tested positive. That number has not changed since last Thursday. And team members that we've tested, this number has now grown to 288 tests. And this number 12 has also not moved since last Wednesday. 12 team members have tested positive over the course of these last 19 weeks. Can't believe it's only 19 weeks. So that 10 number and that 12 number have not moved since last Wednesday. If anybody has any questions, the birthday girl is manning the phone here. It's a big birthday, turning 30 again. If anybody has any questions, feel free to text this number. I'm going to move into shared values in our mission statement. Last week we talked about the 3 W's: wearing a mask, watching our distance from one another, and then washing our hands. I just want to point this out. There is a reason. Can you zoom in on this, Eddie? There's a reason why Jack Johnson and DJ and the entire maintenance team made these hand washing stations. First, what happened back in March, we noticed from our suppliers that the hand sanitizers, that liquid was becoming increasingly difficult to procure. And so Jack and the team decided that in order to make it a safe entry for people, that we created these hand washing stations. And so meaning Sharon Brown and James Green, are trying to procure hand sanitizing stands where the pump sits on, so we have something more decorative in front of all of our entrances. And we're still trying to procure those stands. So in the meantime, we have these sinks. So why am I bringing this up? So the 3 W's: wearing a mask, watching your distance, and washing your hands doesn't just apply to washing your hands inside of your apartment or your cottage, or when you're leaving a public bathroom. When you're getting out of, and I'm talking about team members, residents, anyone that's listening that's actually driving into the property, when you enter the main building, you are actually touching a handle to open a door, unless you're coming into Parkview and or the main entrance. And when you touch that handle, depending upon what you did between getting out of your car and then arriving to that door, really depends on what is your next step is to do once you go through one of the 17 entrances around this building. And that's why we have these hand washing stations. It is really critical that you wash your hands after you enter the building. We have these stations all over the place. And it's a great infection control step in entering the building. The first thing we should do is wash our hands at these sinks. So I'm just making a public service announcement to give another push to washing hands when we enter one of the 17 entrances around Cedarfield. Most entrances have the hand sanitizing pumps, some do not, but every entrance has this hand washing station. So let's get back to some basics and take the time, take the 30 seconds to wash our hands, sanitize our hands at the entrances. Additionally, there are a few elevators in and around independent living. And one of the things that the infection control nurses pointed out on the license side of the community, but I think it is very relevant for independent living. If you're riding an elevator, we really should only have 2 people in an elevator cab at one time. That is socially distant. So as we're waiting for elevators and elevator doors open up and you see more than, or if you see 2 people in there, could you please just kindly wait for the next elevator, where we're trying just to limit 2 people in an elevator cab at one point. Okay, next up is Matt Dameron. For those of you that don't know Matt is the Associate Executive Director in charge of our licensed areas and our Wellness and Leisure Department. Matt has the topics here of the point prevalence survey, our infection control assessment from Monday. Give everybody news about those 2 things. So.
Good afternoon, everyone. Thank you, Michael. So I want to kind of give you an update as to what's been going on in the licensed portion of our building. It's been a busy couple of weeks, and there's no signs of that slowing down as we continue through this process. So just a little bit of background on the point prevalence survey, these infection control assessments, things of that nature. So this is actually guidance that originated with CMS. They put out certain guidance for reopening nursing homes. So then the Virginia Department of Health, who regulates our neighborhoods up in healthcare, they adopted that reopening plan, and then shortly after that, the Virginia Department of Social Services adopted the plan as well and said that all assisted living communities should follow these rules as well. So that is why independent living has the Cedarfield Forward plan, and the licensed portion of the building now has a 3-phase plan of their own, and certain milestones have to be met in order to go through these phases. So in order to even go into phase 1 of reopening that section of the building, there's quite a few things that you have to accomplish, and 2 of the most important things are the point prevalence survey and this infection control assessment that I'll talk about here shortly. So we have gone down this path. As Michael mentioned, we conducted a point prevalence survey, or a PPS, last Thursday, July 9th, and it was conducted by the National Guard in concert with the Virginia Department of Health. We ended up testing, or they ended up testing roughly 285 residents, team members, private duty personnel, beauticians, hospice workers, and so on. It was quite an event, and they really streamlined the process because these National Guard teams are all around the Commonwealth providing this service. I was outside with the team the entire process and spoke to some of the people in charge, and they do this at least once a day, where they visit different retirement communities, hospitals, and so on to conduct this service. So they really streamlined it. They were able to do 285 people in about 2.5 hours. So it was a very quick process, and it required quite a bit of organizing, which Connie McGowan, our infection control nurse, she has taken the helm on that, and was able to get people in here, all different shifts, all different, it was quite a sight to see. We did a drive-by, or a drive-through, that's a better term, drive-through testing in the back parking lot for all the team members and personnel that weren't on shift at the time. So results are trickling in from that survey. It has been a little slow, to be honest with you. The Virginia Department of Health decided to use the UVA lab for our testing because the other lab that they've been using here locally was pretty backed up at the time. Like I said, these tests are going on constantly all around the Commonwealth, so labs are pretty backed up with getting results. So far, we have officially received about 19% of the test results. And we've learned that those results are going from the UVA lab through the Virginia Department of Health and then to us. So they have worked out the system, albeit slow, where they will contact us if we have positive cases. And all negative cases, they're basically forming a database for us so that we can have that information moving forward. So that was last Thursday, and part of this reopening plan is to test again 7 days later. So tomorrow, we will be testing the exact same group of people, roughly 285. I think we've added a few to that list. And that testing will not be done by the National Guard. That will actually be done by our nursing personnel. So our nursing team members, the clinical leaders, Connie McGowan is again kind of organizing all of that for us. She has set up time frames for team members and private duty personnel, all the people that work and live in that section of the building. She's lined up time frames for them to come in and get tested. So that will be happening tomorrow. There's some in the morning, there's some in the afternoon, but we're pretty confident that all of the residents in Sunshine Plaza, assisted living, and healthcare will be tested tomorrow morning, sometime between 9 a.m. and 12 p.m. So we're using the GenWorks lab, which is a lab that we've been using for some of our individual tests, and that is located right down the street here in Innsbrook. So we're looking forward to working with them more and getting those results back timely. So that is all the information regarding our testing. And I just wanted to touch on this infection control and prevention assessment, the ICPA. That is yet another requirement set forth by the CMS, Virginia Department of Health, and Department of Social Services as far as the reopening plan. And this is lined up with a third party that works with the Department of Health. And they have teams of nurses that go around the Commonwealth, sets of 2, there's 12 teams at a time, 2 nurses in each team. We learned from them on Monday that they actually do 2-week rotations, and then they get another set of infection control nurses. So these 2 registered nurses were from North Carolina. They specialize in infection control and have been specifically trained in infection control practices as it relates to COVID-19. So we were very thankful to have them on site to really give us some guidance and look at our practices, to let us know exactly, what we needed to improve upon, and where we're going right, where we're not, things of that nature. So they were here on Monday, July 13th, from a little bit before 9 to a little after 2 o'clock in the afternoon. They spent quite a bit of time with Connie McGowan, our infection control nurse, Melissa Silers, our director of nursing, and myself. We went over policies and procedures, mostly regarding infection control and COVID-19, and also everything from family visitation policies to our leave policies for our team members, as well as just general cleaning, everything you can think of. It was a pretty lengthy list. They then took some time, went around to the different areas in Sunshine Plaza, assisted living, and our 3 healthcare households. They spoke to team members, observed practices, they inspected the kitchens in each level, observed medication passes, the donning and doffing of personal protective equipment. They really did a thorough assessment of where we are. So at the end, they sat down with the 3 of us to go over their report. We'll get the official report from the Virginia Department of Health here hopefully pretty soon. But they gave us all the main points from that, and we did extremely well. They were very impressed with our policies, our procedures, specific things, to be exact, our family visitation policy, our team member leave policy. They went on and on about that, actually. They visited quite a few organizations that really do not provide any assistance for team members when they contract COVID-19. So they were very happy with that, and actually are planning on sharing that with their fellow nurse teams. So they found very minor recommendations. I'll give you just a couple of highlights, and that are very easy to fix. One would be frequency of housekeeping, kind of high touch areas, how often we wipe down doorknobs, railings, things of that nature. There is no standard regulation-wise for this, but they have noticed that other communities do it every 2 hours. So we've put that practice in place already. We were doing it quite frequently, but not every 2 hours. So we have put that into place. Social distancing signs in the elevator, Michael mentioned that. Having something in the elevator saying that there should only be 2 people in the elevators at a time. Adding a few more hand sanitizing stations so that they're very easily accessible to residents and team members. Educating residents on hand washing, proper hand washing techniques. They were really happy with the team members. They just wanted to make sure that we're also educating the residents as well. And really, those are the big things. It wasn't very much. They were very happy with our medication passes and the infection control procedures that we take there. They did want us to have the med cards visibly wet when at the end of each medication pass to make sure that they were truly sanitized. So the team was very happy with that. The nurses had a lot of compliments about our community in general, about how friendly the team members were and how accepting the residents were to have the nurses here too. So it was a good thing to have them here. They were also very happy that we had been working with the local Department of Health since the very beginning of this pandemic. They expressed that a lot of communities that they've been into have been incredibly resistant to that. So working closely with the Virginia Department of Health is something that they were very happy with. So anyway, those are the big things here the last couple of weeks, and we have another big day tomorrow, making sure that all of our residents are tested. So if you have any questions, please feel free to reach out to me, and I'll be happy to answer anything. Do you have any questions coming in? No. Okay.
Thank you, Matt.
Thank you.
Appreciate your leadership and all that you are doing. Matt and Connie McGowan and Melissa Seiler, three people at the helm of organizing all this testing, along with all of the clinical leaders and the neighborhood leaders of our 5 neighborhoods have been it's been all-inspiring to watch everybody come together and plan out all of this testing. So thank you to all of those individuals. I know it's a lot of work. I know because I helped organize the first point prevalence survey back in April. And so thank you to everybody for organizing it. One question did come in. Having fancy hand sanitizer holders is not important. Use the money for something more important, like fixing and hanging wallpaper in the hallways. If anybody knows where hanging wallpaper is in the hallways, this is not something that we are trying to forego. Maintenance department will fix hanging wallpaper anywhere. So if anybody knows of where wallpaper is hanging off the wall, please let us know. I do believe that hand sanitizing stations are important so that they're visible in front of people as you're walking into an entrance, and not affixed to the wall where they just become part of the wall and people forget that those stations actually exist. If anybody has any other questions about COVID-19 or our plan, please feel free to call the administration suites or Matt Dameron's office. We'll be happy to answer as many questions as humanly possible before the end of the day. Our goal is to answer emails and texts and telephone calls the same day. If we don't happen to get to that question, feel free to please know that we will try our hardest to get back to you no later than the following day, 24 hours. Thank you to all of the residents and family members or even friends. We had a donation all the way from London in the Heroes campaign, even team members. So thank you to everybody. It's been a very awe-inspiring last 2 weeks to see the philanthropy efforts. It's created a lot of energy at the campus. So just want to thank everybody. Those of you that have not contributed or are considering contributing to the Heroes campaign, we still have 2 more weeks left in this campaign effort. If anybody has any questions about the campaign itself or what the funds are intended to be used for, please feel free to reach out to myself or Alice and Zach, our Director of Philanthropy. We'd be happy happy to answer any of your questions about the Heroes Campaign. But in the meantime, again, just a thank you for your generosity. It's been really great in the last 2 weeks. I mentioned this last time, rehab services is more critical now than ever. Residents that, if you're noticing little things that you might need physical therapy or a cottage or an apartment review of your setting, or some speech language pathology services, please feel free to reach out to our Health Pro Heritage team. They are here. They are ready, willing, and able to meet the demand. We now have about 145 people seeing them at any one point in time throughout the week and the month. So that's great. It's an uptick from 123 last week. So whether residents are identifying things that they need rehab themselves, and or nurses are helping, or the therapists themselves are pointing things out, I think that we have a good, healthy number of people really benefiting from that service. Ann Hopper did want me to give a little plug about emergency protocol. I know this is really small, Eddie. There are residents out there that think that we have stopped emergency services at the campus where a nurse will not be present if you pull your pull cord, and that could be furthest from the truth. If a resident in an independent living apartment and or cottage is experiencing an emergency, we have nurses around the clock. Those nurses work in healthcare, and they will arrive to your setting in full PPE. They'll be protected. So Ann wanted me to relay to people that service is central to Cedarfield and is alive and well. Additionally, we have a company that we partner with called Dispatch Health that can also help triage some emergency situations, maybe even to avoid going to the ER department at the hospital, where we can actually just triage your situation right in your apartment and or your cottage. Why is that important, Eddie? You are right. Because if a resident goes to a hospital or an ER department, you have to quarantine for 14 days. But if you have Dispatch Health come in and triage the situation, that restriction is lifted. So we really have a great partner, and the nurse who works during the evening and the supervisory nurse that works during the weekend knows how to get a hold of this Dispatch Health. So that service is alive and well. Okay, next up, for the sake of time here, since we are approaching quarter of, we do have a virtual memorial service, which Trish is going to talk a little bit about. So Trish is here to talk about some spiritual well-being, some good news, and then our virtual memorial service. And then I'm going to come back, and Eddie and I have 1 2-minute video to show you to round out this live stream. Trish?
Good afternoon, everybody. At 4 o'clock today, directly following this, we will have a very brief remembrance for Sam Dario. And because we are doing that today, our spiritual focus is going to come from a book called Finish Up Strong. There is a chapter dedicated to Sam Dario, and I just want to share with you a brief portion. This scenario is about a time when Sam's father was in his final years, and Sam would go visit him while he was in bed, his father. On one occasion, Sam shook his father's hand as his father lay in bed. Sam said, "Dad, your grip is really strong," provoking the response, It is the only thing about me that is functioning properly. Sam's father's doctor had recommended ongoing medical care at the hospital in Charlottesville. After several visits, Sam's father asked, "Why are we doing this?" He said to the doctor, "Let's stop." Sam concurred, telling his father, "Dad, there's no reason for you to go to the hospital again." His father took no more tests. Dario's father told Sam that he did not feel that Sam even needed to continue to visit because, he said, "I am not afraid." Sam observed that his father remained contented at home until death. Sam added, "Comfort and a sense of contentedness is the best you can hope for." As a boy, Sam had wondered how far space might go and whether or not something lay on the other side. Sam said, "Man cannot understand anything that is infinite. When you know for a fact that there is something we cannot understand, let's not be puzzled by it. Let's just accept it." Sam added, "I do believe that whatever comes after death will be peaceful and pleasant." So please join us at 4 as we remember Sam. And now for our good news. It is from Lou and Charlie Weber. Meet puppy Lisbon. Lisbon is a very important puppy, and here's why. He makes people happy. It's true. He's making me happy right now, and I haven't even met him. More importantly, this puppy brings joy to the sweet girls in this picture who are holding him. Their names are Emily and Charlotte, and they have brought joy into the lives of Lou and Charlie Weber, much like this puppy brings joy to these girls. You see, as these girls were growing up, they were neighbors of the Webers, in addition to being part of their church family. If we're lucky, we can all think of some neighborhood children who still make us smile when we think of them. God bless all the neighboring children who have made each of you smile. God bless Emily and Charlotte for the joy that they have given to Lou and Charlie. And God bless Lisbon the puppy, who brings joy to absolutely everybody who sees him.
Thank you, Trish. So our last little segment here before we go into Sam Dario's virtual memorial service, I just want to bring up Friday night movie Under the Stars. And I bring this specific event up because there is, in this COVID-19 world that we're living in, it just seems like there's all things that are restricted or things we can't do anymore. That it's so easy to say we can't do that because of COVID-19. It's a very easy phrase to say now. And I just want to reassure residents and team members that at Cedarfield, we are trying to find a balance. We're not going too far to the left, we're not going too far to the right. We start with yes and see how we can fit in things into our three-phase plan if we can. Our automatic response is not, no, we can't do that. And Friday Night Under the Stars is a great example. Amanda and Lori, Fiona and Carol, members of the wellness team, and certainly the man behind the camera here, Eddie, were so instrumental in saying, yes, we can, to this event. Over 50 people showed up last Friday night to watch a movie in our wellness courtyard under the stars, with threatening skies all week long. It was supposed to thunder and lightning all week for Friday night, but we waited until the very afternoon on Friday to decide whether or not we should move forward with it. And so this is just one of many examples where we start with yes. And I just want to continue to encourage people to start with yes in the middle of where everything seems like, no, we can't. That's not our approach right now. And so I want to show you one little clip. Eddie's going to zoom in on this screen. I want to show you one thing before we leave.